Hey everyone, welcome back to the Reinhardt's Rundown. This is our next video in the tobacco cessation series. Today we're looking at questions you may get when your patient is getting started on nicotine replacement therapies, or NRT. We'll drop the link to the last video which compared NRT against other oral option. That's in the notes. If you haven't seen it yet, go ahead and take a look. All right, moving right along into today's question on nicotine replacement therapies, or NRT. Question 1, can I swim with a nicotine patch on? Sure, you absolutely can. You can swim, you can shower, you can go in the ocean, you can go in salt water, fresh water, all okay. The patches are water resistant. Now, that being said, if you haven't seen the video on patch medications and hot tubs, go ahead and check that out. It's in the notes as well, because heat can impact patch therapy. Question number 2, what do I do if the patch comes off? Now, of course, the best strategy here is making sure that we follow those instructions as carefully as possible when we apply the patch to help make sure it doesn't come off. We do have a video also, things to know before starting the nicotine patch. Remember all of those pearls of applying to a dry, hairless area, avoiding lotion on the skin, all of that, that's worth a quick review, and the link is below. That being said, I live in Florida. People sweat a lot in this state, so if the patch comes off because of sweating, or maybe it just didn't have a good stick and then came off, what you can do is you can just toss it, apply a new patch, and then get back on your traditional regular application schedule the very next morning. If the patch keeps coming off, you can apply a medical adhesive tape over the very edges of the patch. This is not something we do with all types of patches, but should be just fine for a nicotine replacement patch. That's the Reinhardt's Rundown. Go ahead and subscribe if this video is helpful. In our next video, we'll talk about who can and cannot start nicotine replacement therapies.